And hello, everyone, and welcome to Bubble Talk. I'm Toni Rodriguez. I'm your host today for episode 18. And boy, do we have an incredible show in store for you. I feel completely honored to have this next guest on my show today, episode 18, Dr. Goyal from First Primary Care, which is the perfect segue to go in to talk to you a little bit about my sponsor. My sponsor is First Primary Care. If you have health insurance that's too expensive with too little coverage, or if you don't have any health coverage at all, there are alternatives. You need to go and check out First Primary Care because they are giving you an incredible alternative. Better access, 30 to 60% less than insurance. And if you go to our description in today's show, you will find a link. Go check them out, please. And if you mention Bubble Talk, you will receive 50% off your initial enrollment fee. Please check out First Primary Care. And now, without further ado, I would like to introduce the creator, CEO of First Primary Care, graduate of the Yale School of Medicine in Pulmonology and in Critical Care. Without further ado, I would like to introduce to you Dr. Goyal from First Primary Care. How are you, Dr. Goyal?
I'm good, Toni. How are you?
I'm incredible. I feel excited to have you on my show today. And I know you're really busy, and I really do appreciate you taking the time to be my special guest today.
Thank you. I was looking forward to it.
I'm excited. So what we decided in our little pre-show chat is that we are going to talk about three things that the media has not told you, my viewers out there, Bubble Talk, about healthcare or medical insurance or just the whole healthcare system in general. And so I'm going to go ahead and let Dr. Goyal talk a little bit about maybe point one, or the first thing that we want to inform our Bubble Talk viewers about.
So I think you won't hear media talk about insurance alternatives, because in the last 4 or 5 decades, all we know when we think about how we buy healthcare, all we know is health insurance. And that's not accurate. There are other ways to cover your larger risk for healthcare, as well as other ways to buy healthcare services outside the insurance world. And you don't hear media talk about that. And those alternatives have become more and more mainstream over the last 5, 6, or even maybe 10 years, because health insurance, as we know, has become more and more unaffordable for middle-class Americans.
Right. And I mentioned that to you, Dr. Goyal, earlier, that's how, for so many years as a dance instructor, choreographer, as a 1099 employee prior to, and even as a real estate agent now in my new career, I find that for many years, the way I was able to sustain my healthcare is by having that little stash or that little savings that I would save for the rainy day. But it was almost taboo because we would get charged, by the IRS or by the government if we didn't have medical insurance, or it was taboo to tell people, oh, you don't have medical insurance, how irresponsible of you. But I mean, it was because at that time I could not afford the very high premiums, because they made it so difficult for single moms or working moms to be able to afford healthcare coverage. So it was almost like kind of an embarrassment, or it was just ashamed, or my parents or all of my friends who worked in corporate America said, oh yeah, it's an absorbent amount, but we have to have it. It's very important. So the way I was able to maintain myself was pay for my health services in cash.
That's correct.
Go ahead. I'm sorry.
You're absolutely right. I think you will also see that a lot of the times, actually, if you pay for health services cash, they are more affordable as compared to using your insurance. And we see that time and time again. Initially when health insurance about 10 years or so ago, it was relatively affordable. Deductibles were not high. So people weren't really worried about okay, what is the total cost of this service that we are buying through our insurance card? Because the true cost is really hidden behind the copays. Now that the deductibles have gone up to $5,000, $6,000, and you're having to pay the entire bill of this service out of your pocket, you are shocked to see some of the prices. I've seen people being charged several $1,000s for an MRI scan, whereas if you pay cash for it, you can get it for $300, $400.
That's incredible.
So
Yeah.
that whole disconnect doesn't really make sense.
Correct. So you feel that the media has led us to believe that healthcare is just unaffordable, just absorbently unaffordable. That would be our first point, that the media has, just led us to believe that unless you have a tremendous amount of money, you can't afford good health care.
Or you have a really good insurance policy that you can't really afford good health care. And I think even the changes that were brought on by Affordable Care Act, the premise of that was if we just give more people insurance, the healthcare problems will go away. Or if we give everybody health insurance, the problems will go away. But the issue was people are walking around, with a $5,000, $10,000 deductible as a family. And I call them functionally uninsured, basically.
Wow.
What is the point of the policy that you are paying a monthly premium for, but when you do need to use it, you're scared to use it because of that high deductible up front?
Which is crazy because you're barely making your premium payments every month and so petrified and just waiting till you've had this sinus infection or this bronchitis for weeks on end. And then you have to be hospitalized. And that's when that catastrophic issue happens to you where you're like depleted physically and financially. I mean, you're in a horrible position at that point.
That's correct. And in the whole system of buying everything through a third party, right? When we buy healthcare, we assume that insurance is gonna negotiate the price of healthcare and keep it at a reasonable, cost. But again, as we have seen that when you buy healthcare through insurance, the cost gets inflated. And that inflation has again contributed to the fact or this notion that healthcare is so expensive. And again, when you peel those layers away, those third parties away, and you start buying care cash, you realize that look, majority of the care is actually much more affordable, especially if we take away all that administrative cost associated with it away from the care.
Wow. This is, I'm just fascinated because I lived this process. Like everything that you're saying, it's so relative to how I live my life at this moment. And what about point number 2, Dr. Goyal? What would you say would be the second point that the media has not told us, the public, about healthcare?
So the second, again, thing I believe is that there are alternatives to insurance that you're not going to hear about. There are some, so one solution that I talk about all the time, which is the core of our business, is membership-based medicine. So what is membership-based medicine? There is a movement happening across the country called direct primary care. And what direct primary care does is, before I explain direct primary care, let me give you an analogy, which I think our viewers will appreciate. That, we all buy insurance. We all buy car insurance. We may buy life insurance, disability insurance, homeowners insurance.
Sure.
We never buy insurance in hope to use it, right? We buy insurance to cover a large, unpredictable risk, and we really hope that we never have to use our insurance. We'll never use our car insurance policy to go pay for an oil change or to fill your gas tank. Or if it's a flat tire, you won't say, okay, charge my car insurance policy.
Yeah.
That will be insanity, right? We pay for regular minor stuff, cash, and then we use the car insurance for when the car gets flooded, car gets broken into maybe, or we get into a car wreck. So big, unpredictable stuff that we know is going to happen rarely. That was the purpose of insurance. And when health insurance started covering more and more healthcare services, again, it took the consumer completely out of healthcare, and we handed the control to third parties, basically, and the cost went, totally north, basically. I mean, we have no idea what anything really costs in healthcare.
Sure, everything's inflated.
Everything is inflated. So what the idea behind direct primary care movement that has really taken off over the last 5 years or so is that let's not use health insurance to buy 80 to 90% of the healthcare, which is routine and predictable. So what is routine and predictable? Preventive care, your well visits, your minor urgent care, which is, like you mentioned, sinusitis, bronchitis, back pains, headaches, sore throats, all that is minor urgent care, which is bound to happen. There's really no unpredictability about it, especially if you're a family with kids. The kids go to school, they are going to get sick. They are going to get bumps and bruises. It is not a catastrophe. It is routine and predictable care. Then comes chronic disease. As we get older, we do pick up diseases like high blood pressure, diabetes, sleep apneas, for which you are on medications, anxiety, depression, and you really don't need insurance to pay for those, again, routine, ongoing care stuff. So direct primary care, what it does is it takes all that care that is routine and predictable, provides directly to the consumer at a monthly membership-based manner. So our members pay us a fixed monthly fee for all the primary care they can get from us. There's no billing, no coding. Our life as physicians is much easier because there's no insurance company now telling me how to provide care to patients. I don't have to chart, extensively on my computer to show the insurance company that I provided care to you. The only person I need to show that to you is you, basically, the person paying me directly. And so a lot of noise goes away and care becomes much more accessible. People can text us, they can video chat with us, we can phone call and provide care. You come to the office, there is no waiting room. Office visits start on time. There is a ton of office procedures we can do at no cost to you.
So it's really stripped back down to the basics like they used to in the old days, where you had more of a personal one-on-one relationship with your physician.
Absolutely. You hit it on the nail on the head. That is exactly what it is. I call it going back to the future. So
that's incredible.
Yeah. Studies after studies have shown that having a relationship with a primary care doctor is important. Having your own doctor who you can access on a timely manner, who knows you over time, over years, is important. It saves lives. And that's what we are trying to get back to, is that, look, we want to work for patients and not for anybody else. So overall, the membership-based medicine has really taken off. Physicians are benefiting from it because they are able to provide a lot more value without any interference, and patients are getting better care, timely care. And so what the idea behind this is that you use membership-based care for your routine day-to-day stuff, and you buy a catastrophic coverage to cover the large, big bad stuff.
Okay, so the plan is, for me, $99 a month. I'm a 51-year-old. Depending on your age, you will pay a lower premium, but that would be covering my day-to-day visits, sinus infection if I have one. I mean, knock on wood, I've been good. And then there's a secondary premium that's added to that for my catastrophic, which is what you just finished explaining, correct?
That's correct. So there are different ways to cover the catastrophic risk also, right? Again, traditional insurance is one way of covering the catastrophic risk.
Okay.
Another way of covering that risk is medical cost sharing. And again, media will probably not talk about medical cost sharing. Mm-hmm. You may hear about medical cost sharing on some conservative radio talk shows, but otherwise you don't hear it in the mainstream media. And medical cost sharing is an excellent way of covering the larger risk.
Wow.
And the idea behind medical cost sharing really is, it's a community of people that pool money and share into each other's medical expenses. So, your viewers may have heard about MediShare or
Yeah.
HealthShare, but over the years, these cost sharing ministries have evolved into non-religious, open to all, but they don't have the perverse incentives of the traditional insurance companies. They don't have CEOs, CFOs making multi-million dollars a year. It's much a people-run co-op, so to speak,
Co-op. Mm-hmm.
money, and then as people have large bills, you pay them back.
It's covered.
Yeah.
So what's happening is, those are already 3 great points of that we don't get a lot of information from the media about. And if we didn't use social media and we didn't engage in these types of shows where they're interviewing people like you who are very much a part of this new alternative for healthcare, then no one would be informed. And one point that you did make that you mentioned earlier in our pre-show chat was fixing the healthcare system at a local level versus fixing it at a larger, higher corporate or / government level, correct?
That's correct. And so I talk about that solutions to healthcare should be grown locally. The solutions to fix healthcare are not going to come from our government. I think it is more a free market approach to healthcare that is locally grown, that understands what the local landscape is. It's patients and doctors coming together in local areas that can, have a much more impact on fixing our healthcare system rather than us waiting and expecting the solutions to come from our government.
Got it. So I just want to make a comment and say hello to our viewers. And if you have any questions for Dr. Goyal, please, you guys feel free to let us know, and we'll be happy to answer those questions for you towards the end of our broadcast. So Dr. Goyal, besides these 3 points, I know that I'm fascinated with the whole idea of having alternatives to my healthcare. But also, I would like to, I lost you. There you are. I would like to speak to you because I am a health and fitness and wellness buff and try to do, I don't know if you can be a wellness buff, but a fitness buff. I try to do as much as I can preventatively for myself. I'm very proactive in taking good care of myself so that I don't have to, and maybe that's because I've paid cash for so long for my medical needs prior to finding first primary care. But what types of screenings, because I know I have a lot of athletes and yoga instructors and dance instructors who are my viewers, what kind of screenings do we have accessible to us now that maybe we didn't have 10 years ago that can help us, stay healthy?
Correct. I think, first of all, like you said, you have to do self-care, right? There has to be a culture of health. And you are in control of your body, and you have to live a healthy life. 3 main things I talk there, which I believe form kind of the pillars of health, are starts with sleep. Get good sleep every night.
I'm terrible at that. I know I should sleep.
So
wow.
Get good sleep, 6 to 8 hours at least. And second thing I talk about is eat well. And I don't usually give dietary advice to people because it changes every 10 years, what we know about food. But, being knowledgeable about what good food is and what bad food is important. So because our nutrition is what makes our body. And lastly, regular exercise. So I think if you're sleeping well, eating well, and exercising regularly, you in general are gonna keep your healthcare costs low.
Okay.
On top of that, again, you do need a doctor's help. So usually what we do is there is when we start a relationship with any of our patients, we do an extensive lab panel, so we can understand where you stand, which includes your cholesterol panel. So anybody who, regardless of age, really, but we're mostly talking about adults here, they should know what their cholesterol panel is like, what their height and weight is like, or what we call is BMI. Um, and so we do another other labs like your blood counts, your kidney function, liver function, your thyroid screen, diabetes screen. Your family history is important. Genetics play a key role in determining what kind of diseases we may encounter as we grow older. So knowing your family history and based on that, appropriate screenings for high blood pressure, diabetes, like I mentioned, are important.
So continue with our regular yearly, like once a year. Is that still the norm, or is that another thing that people just put in our heads?
Once a year, I believe, was more of an insurance instruction. Then look, you got to go visit with your doctor once a year, and what is to say that more than once a year is not better, right?
Right.
And that's kind of what we are trying to promote through our model is that, look, you pay us a set amount of fee each month. You can visit us any number of times you want. We want you to talk to us with small concerns, large concerns, so we can help you in a more timely manner. So that once a year visit then just is not necessary because we've been talking all year.
Right.
We've been communicating all year.
Okay.
Once a year blood work is I think reasonable. If you haven't done any blood work in a year, you should at least know, okay, what is happening to my cholesterol and all the numbers basically. But there are age-appropriate cancer screenings that make sense. Well women exams to do a pap smear for cervical cancer screening, mammograms for breast cancer screening, colonoscopies for colon cancer screening over 50, prostate exams for men, and lung cancer screening has been approved now in certain age groups that have smoked for at least 25, 30 pack years. So there are age-appropriate, cancer screenings that are recommended.
Okay. Because I was having a conversation with my mother. I know she's watching, Mary Helen, and she's 77. And she said, back in the day, and she watched your interview, by the way, with Randall Chestnut. So she was fascinated too, as well. And she is a 2-time breast cancer survivor. And she also is retired from 25 years service with the American Cancer Society. So she's very familiar with a lot of the oncologists that are prevalent today. And she was saying, when we were growing up or when we were younger, those types of screenings weren't really accessible to us. I think they were still being created, but now so much is accessible to you. You're so lucky. And why more young people, of course, she calls me young and I'm 51, but she's like, why more young people do not take advantage of those types of screenings? Had she not been proactive and found a lump, during Thanksgiving dinner one day, she would probably not be here, but she went immediately. And so many people are afraid and scared of going to the doctor because of what you, Dr. Goyal, were mentioning earlier, and that is the expenses that come from the catastrophic, things that happen in our lives. And I just wish more people would kind of turn. I think that first primary care is definitely revolutionizing the way millennials and younger generations are thinking now about taking care of themselves and understanding that you no longer have to be fearful of going to the doctor, that you can pay a minimal premium and be able to have a one-on-one relationship with your physician that knows that you run every day or knows your prior family history, and where you can feel really comfortable and confident about saying, hey, I've had this thing on my arm, and should I be concerned, or is it just from being in the sun because I work outdoors or what have you? Before, people would just let those things grow and into big issues. And now with First Primary Care, I feel confident that if something were to happen, I feel comfortable being able to reach out to my doctor and have a quick consultation and not have to set the appointment and drive there and sit there and be exposed to other sick patient. I mean, the list goes on and on.
Yeah. Who wants to spend half a day for a 10-minute visit? And you're absolutely right. It was, what I call is that we are trying to redefine value in healthcare. That we have been spending a lot of money in insurance premiums. We just don't see the value. And when it comes to needing healthcare, it is so inaccessible a lot of the times, and we end up kicking the can down the road. And that has to change. And so First Primary Care, even the name when we came up with, the idea was make primary care first. But if we make primary care highly accessible, predictable, convenient, and bring technology into the mix, because healthcare, I believe, as we know, traditionally, it is still stuck, 50, 60 years ago. Technology has made great leaps, but it hasn't really incorporated into how we deliver healthcare.
Correct.
So with our model, we are leveraging the technology to connect with our patients, whether they are at home, whether they are at work, whether they are on vacation. They get to talk to their own doctor. Merely we are a text away. So
that's amazing.
That people tend to bring small problems to our attention much faster and much easier. And we are able to communicate with them on an ongoing basis. Healthcare is a continuous process. Healthcare is not an episodic process. Our traditional fee-for-service system makes it an episodic process, and that's what we're trying to move away from. And cover the larger risk in a sensible manner, and not to cover everything.
Right. For me, it's about keeping us healthy, right? I mean, that's really, it's not sick care, it's health. Keyword here, people, it's health care. It's about keeping us healthy, and it's less work and time for your doctors. If we communicate and we talk, and like you said, a quick text, you're keeping us healthy, and then we don't have to spend as much money down the road with something traumatic, because we were neglectful to communicate because we didn't want to get charged the copay and then the tests and the time. And I mean, just to with my son, because I'm a divorcee, he has medical insurance through my ex-husband, just to get him to get a physical. He runs track for Woodlands High School. It's like moving the earth. I have to get him out of school. I have to go make an appointment. I sit in there for 30 minutes. He tries to do it on his lunch break. We're waiting and waiting. I mean, I love his doctor, but we briefly get to communicate. It's maybe a 10-minute visit, like you said. I don't even know if she completely checks him. It's just like in and out, pop, pop, pop. And then here, I need your credit card and pay your I mean, I feel like I remember my mom's incredible oncologist and how they really at MD Anderson took time to communicate with her. And I was like, my poor mom, who has this disease, gets better attention, medical care attention, because she's so sick, versus my son. And I really want him to get checked out. And because we don't go very often. And it's just like, everything that you say, I'm not sure why everyone is not a member of First Primary Care at this point. Because why would you not take advantage of paying one lump sum, you guys, and having all of this accessibility to a primary care physician at your fingertips? No, gone are the days where my friend is a doctor and so I can text him. No, this is your doctor. This is your primary care physician doctor that you can text and on a regular basis and communicate with them. When events come up. I want to talk about your office. You have an office here off I-10. It's your Spring Branch office, correct?
That's correct.
Okay, that's our one location here?
So we had our first office in Spring Branch off of I-10 in Bengal, and we recently opened our second office in Spring Woodlands area.
Yay, by
Yeah.
me. I'm
Correct.
so excited. So you have let me tell them about this. You have a ribbon cutting for your new office here in the Woodlands off of Rayford Sawdust. The new address is 25144 Grogan's Park Drive, and I will definitely put that in the description of today's show. It is your ribbon cutting on September 27th at 4:30 p.m. Congratulations on your second office.
Mhm.
That's awesome. And so for all my friends out here in the Woodlands on Spring, Magnolia, Conroe, all my real estate agent friends, all my dance friends, listen, I'm not going to steer you wrong. I love your children. I've been teaching dance here for 10, 11 years. So I've gone through like 1,700 families. I am going to strongly encourage you to check out First Primary Care. Sign up for a consultation. They can talk to you about the best package that's a perfect fit for you and for your family. And check out the ribbon cutting ceremony on September 27th. I want to say hi, Dr. Goyal, to some friends who are listening. Sabi, Gutierrez, how are you? Kelly Hardwick, thanks for tuning in. My sister Marissa Martinez Edgecombe, how are you today? Randall Chestnut, hey Randall, how are you? Karen Gomez, Karen, Chris White, hello. My Aunt Adeline from Helotes from San Antonio is watching. Karen has a quick question for you, Dr. Goyal. She says, I need a tip. How do I get my husband to see a doctor? He has not seen a physician or had a checkup in over 4 years.
Men are kind of notorious to kick the can down the road, I believe. I think, again, the problem is that going for a checkup is such a hassle. And I believe her husband will really enjoy the way we provide healthcare. It is not, that industrial feel that you get when you go a traditional primary care doctor. This is more personal. Um, like you said, this is like the old times where people really value the relationship. So he will definitely appreciate having a personal doctor, and will find that he gets a lot more value out of the time that he spends with our doctors. So I would encourage, Karen's husband to at least take a look at our website, try our model out. We do have two membership levels. One is just the base membership for primary care only, which is the primary 365, and then the complete 365, which includes the primary care as well as the catastrophic portion of care. So whatever membership level is right for him, he can try it. There are no long-term contracts to try it. It's a month-to-month deal. So at the very least, he can try a primary 365 base membership, and see how he likes it. Go visit the doctor, go get your physical done. Stay a member if you're happy, and if you're not, cancel. No questions asked.
Yeah, I'm definitely going to be at the ribbon cutting, Dr. Goyal, and I'm definitely going to invite some of my friends out. And Karen, I want to personally invite you and your husband to come out and meet the staff of First Primary Care and meet Dr. Goyal personally. It's so impressive. I meet a lot of people, Dr. Goyal, in the opportunities that come up in the social media, and getting to be working with First Primary Care and working with Bubble Talk, and as a real estate agent, I meet a lot of people, but I feel like the relationship that I have formed with First Primary Care, with you, Dr. Goyal, with Jay Medley, with everyone from your group, have been so open and really, really, really nice and warm. And I think that everyone out there, if you give them an opportunity, you will be very, very pleasantly surprised at First Primary Care and the services that they have to offer. I want to thank you, Dr. Goyal. Is there anything else in closing that you might want to mention to our viewers of Bubble Talk before we say goodbye?
Nothing. It's been great coming on your show and talking to you, Toni. We met in person and we've talked about doing this, and so I'm excited that we finally accomplished it.
Yes, I'm super excited about the opening of your Woodlands office. It's right next to my favorite coffee shop, so you're actually going to be seeing a lot of me. I'll always be popping my head in there and saying hello to everyone at First Primary Care. You guys listen. Thank you for all the Bubble Talk viewers who continue to support this show where we talk about fitness, fashion, and living a healthy and positive lifestyle. You can find me on Instagram, Toni_Rodriguez1, and our new Bubble Talk FB Live has a new Instagram, so check that out. If you missed today's episode, you can check us out on the YouTube channel, Bubble Talk, and the iTunes podcast, Bubble Talk. Thank you, Dr. Goyal. Thank you to First Primary Care, my sponsor. Again, check out the link in the description. We hope you have a fabulous Tuesday. Take care of you.
Thank you, Toni.
Thank you, Dr. Goyal.
Take care. Bye.